So very happy to have you, Ingrid, on the PCM4U channel about cross-border access to clinical trial for patients. So Ingrid Klingmann, you're the chairman of European Forum for Good Clinical Practice. You're co-leading the EU XCT program that you will tell us a little bit more afterward. And you have a lot of experience on educational aspects for pharmaceutical development and clinical trials. So could you please tell us a little bit about your background and how you came into working on cross-border access to trials, please?
Yeah, thank you very much for getting the opportunity here to be with you in this interview. Yeah, first of all, I'm a physician and I'm a clinical trial pharmacologist, and I have many years of experience in clinical trial organizing, planning, fighting with problems in clinical trials for very different indications and in very different conditions and countries. In my experience, a relatively frequent issue was that the studies could not recruit fast enough on one hand. And on the other hand, I was approached by patients who were looking for clinical trials, but in their country, there was no clinical trial for their area of indication. So that was a topic that was for EFGCP, the European Forum for Good Clinical Practice, one of the issues that we identified as a problem, because EFGCP is a multi-stakeholder, not-for-profit organization based in Brussels, which was founded in the early 90s with the aim to identify issues in the performance of clinical research in practical terms and to find solutions through discussions with all involved stakeholders to come up with new ideas, with creative ideas. So this was one of the issues that we identified. And in parallel, FPR, the Association of Pharmaceutical Industries in Europe, had in their oncology platform come to similar conclusions. And so they approached us a few years ago to ask whether we could help them by understanding how big is the need, what is the need really for cross-border access to clinical trials. And so we agreed that we would do a research project for them together with KU Leuven in Belgium and with the patient organization Padvocats and with EORTC, the European Organization for Treatment of Cancers. So we did interviews, quite a lot of interviews all over Europe with very different stakeholders who had some exposure or no exposure to the problem, but could perhaps have ideas or had to admit that they have absolutely no chance to do something, like, for example, the regulatory authorities. They were completely helpless or hopeless here at that stage that something could really change. And then we did a big survey and all over Europe to patients and investigators. And the result was really interesting insofar as more investigators than patients responded. And the patients that responded were mostly from Western European countries. So to make a long story short, what we find out in that project was that, first of all, the need is big. In fact, it happens very rarely. And when it happens, then it happens in Western European countries, between Western European countries, but not patients coming from Central and Eastern European countries to Western European countries, what we had expected to hear, in fact, but that was definitely not the case. And in most cases, what we learned was that the patients more or less paid the enabling or nearly all the costs that were required to enable that. Some companies paid for, of course, the study medication, the study activities, and some companies really helped also with additional cost coverage, but it was not the rule. And it was really limited to those patients who were lucky enough to get access to such a trial, but it was nothing systematic. And we came back with these results, we published them also, and then we looked into what options we have to change that. And the most obvious option would be to have a law, a European legislation to solve the problem. But in fact, it turned out that there is a European directive. So a directive is a European law that has to be implemented in the EU member states. There is a directive on cross-border access to healthcare, which gives a guarantee to European Union member state citizens that they can have access to treatment in every other EU country for free. First of all, this directive is not implemented in all countries, as the member states should do, so that is already a problem. And secondly, it does not talk about clinical trials at all. So we have approached the European Commission to find out whether we could have a change to that law, especially because they had just opened this piece of legislation for a public consultation. But unfortunately, the very blunt answer was no way. So we have no way at the moment to make any changes on a European level in the legislation. So the only other option that we identified then as a conclusion of this original research piece was that we would make an effort to collect in all European countries, and not only EU countries, but really all European countries, including UK, Switzerland, the Balkan countries, the national conditions for patients who want to participate in a trial in another country, and for investigators in these countries to host patients from other countries. And to really look into three different key areas. Number one, the legal area. Is there any law? Is there any legal framework? Anything that could give some guidance or free space for doing that? Secondly, what is the healthcare system doing? Is there anything described? Is there anything pre-prepared? Is there any best practice examples? And thirdly, the practical aspects from the investigator side and from the patient side, to see what is there as experience, what have they done, where were their blocks, and what are the practical things that we need to solve, so to say. And that was then the moment when we decided to jointly, FPR and EFGCP, start a roadmap initiative, practically with all different stakeholders, as many organizations all over Europe possible, to help us collect all that information, to put all that information on a website, make that website freely available and sustainably available. And on the other hand, work then with all these different stakeholders on guidances, recommendations, checklists, best practice examples, and also use this joint power, so to say, to find out on the national and European policy level whether we could find solutions, at least in some countries, or hopefully also on a European level. And so we started this with a kickoff meeting in this year in 2023 in January, and the result was amazing, because suddenly we found so many other organizations, projects, initiatives that have the same problem, that identified the problem of cross-border access to clinical trials. And so we are bringing that at the moment all together for a joint initiative activity, because nowhere in Europe, not in any funding organizations, not in any legal aspects, nor in DG Santé, nor in any other of these big EU initiatives, in ACT EU, which is founded to and created to make Europe a more attractive place for clinical trials, this is a topic. So this is a topic that fell between all the chairs everywhere. And but many different organizations like PCM for EU in this project is looking into this, is trying to find solutions. But we think we need to put this on jointly on a higher level to find principal solutions for that in Europe.
So you told us that this is very rare, in fact, that patients cross-border or change countries to go to a clinical trial. But at least for some, and in specific condition, it exists. So my question was, do you know, and could you explain to us quite simply, I would say, are there places or borders that are more easy to cross, if I would say, or initiatives that helps that already? And what is the heterogeneity in this current situation so far?
Yeah, well, yes, in our project and also now in our last month's activities, we found that there are some initiatives, some activities where that has worked. For example, in the Nordic countries, well, first of all, it practically only happens in cancer and to some degree in rare diseases. So cancer is really very much advanced. I think the many projects, initiatives, also the patient activities that are taking place here in that area of indication has really moved that topic to a different level in comparison to other areas of indications, but also in the rare disease area. There is quite a lot of activities, especially the pediatric rare diseases. They are also quite involved in that already. So there is, for example, in PRIMA, that is at EMA, the European Network for Pediatric Medicine. And they are also, they have a project on identifying language as a barrier to cross-border access to clinical trials, and are working on recommendations at the moment for parents of children with rare diseases, including cancer, of course, to figure out what to do concerning the language. In the Nordic countries, for example, they have created cancer boards, joint cancer boards practically, where they know which trials are running in which of these countries, and where they identify patients and then help them to participate in the respective trial in another country. And the agreement is that the hosting country is covering all the costs. And we have found also such an agreement between neighboring university hospitals. So I think it is Aachen, Liège, and Maastricht that are doing as well. No? So they send patients with a respective cancer to a trial that is running in one of these other hospitals, and the hosting country covers hospital covers the costs. So that seems to work, but really on a very small scale. And when you talk with people in the Nordic countries, then they say, yeah, we have heard about that, but we have not seen that it works. So there is also probably some discrepancy between the good intention, paving the way, and hoping that it will work, but it's not a solution for every case, because it's not systematic, and it's not known, and it is not easy to follow. And I think whoever is facilitating that, whatever physicians, hospitals are trying to do that, have to overcome a lot of administrative hurdles, and are not able to solve all the issues. Because one of the key things that can happen is that when you think about the liability insurance in clinical trials, that is that if every patient is insured when he participates in a clinical trial, but these insurance policies are always national for the investigator's country. Now, what happens if the patient goes back into his home country and something happens, a side effect or from the long-term treatment or whatever, and because he needs to visit a hospital in his home country, who is covering those costs? Well, that is not covered at all. No? So there are lots of things that we still need to solve in practical terms, even for the existing cases.
So could you tell us a little bit of what are the different levels of or challenge that you have mapped already and that we need to address as a consortium, as a community for that?
Well, first I must say we are still in the process of data collection, and it is really not easy. What we did, we defined a task force, or we built task forces for these three different topics that I said: the legal ethics side, the financial aspects, and the organizational aspects. And we have so far most information already from the legal side. And we did do that not in the way of a big survey, but we identified individuals who have connections in different countries, networks, so to say, of experts that they could go to and ask for. So we have really we are going to experts in the field who are working daily in clinical trials in those conditions. And so far, I can only say the most of the responses that we get is, I don't know. Well, so there is in most cases, in most countries, there is really not any clearly defined legislation that gives patients the right to participate in a clinical trial abroad. No? So that is, or also clarifying for investigators in that country what it means for them to host a patient from a country abroad. On the ethics committee side, the concerns there are really difficult ethical problems, because on one hand, there is the principle of fairness of access to treatment, and these clinical trials are the last treatment options for patients in many cases. But on the other hand, the protection of the patient, and the main barrier here is not so much the cost coverage. There, the ethics committee trusts that this is going to be solved. But for them, the problem is really the language. And we have countries where the ethics committee clearly says if the patient is not fluently enough speaking that language in that country, even if the patient information sheet can be translated, but the patient needs to be able to communicate with the healthcare professionals in that country, especially when there are health problems, when there are side effects, etc. And that cannot always be enabled through a translator. A translator is not always there. So if that is not guaranteed, they do not allow that patients participate in such a trial in that country. So what is more important, no? The protection of that patient in the situation, or the fair access to treatment, which could be a life-saving or life-prolonging treatment? Very, very difficult. So we will have to have discussions with the ethics committee communities on this topic as well.
So in my practice as an investigator in early phase clinical trials in oncology, we've seen, as you said, quite rarely, but we've seen situations where we have some patient coming from abroad, and we have this possibility in the European space with this S2 form so that the cost of the health or intervention are covered in the abroad, in the hosting country. And also in my practice, it was mostly patients that spoke the same languages, or at least with people who can translate, etc., or at least we speak in English. So that's those two. So my question for you is maybe a little bit practical, but for you, what is the ideal situation for patients abroad to go abroad for a clinical trial, and what are the different steps and the ideal way the patient could pass these steps to facilitate the access?
Yeah, I think you mentioned this this form that is available for getting access to healthcare treatments in other countries, that this would also apply without any problems to clinical trials. That is accepted in some countries, but not in all. So that would be the first thing, that that this form, when patients complete that form, that they have then really complete access also to clinical trials and everything that is necessary for clinical trials in all EU countries. The problem is what happens for non-EU countries, no? And people from non-EU countries coming into the EU. So we are also investigating the differences between the let's say the frameworks for patients when they are outside the EU coming into, or living inside the EU but going outside of the EU. So there is still a huge need for harmonization. Ideally, personally, for me, I think a patient who is so much in need that he does all the efforts to participate in a clinical trial abroad and not just close to his home should get every possible support that is imaginable. And I think it's an obligation to us working in this clinical trial environment from whatever perspective to make sure that this is the least problem for the patient in that situation. So there is still a long way to go, but ultimately I think we should try to achieve that the hosting country and the hosting healthcare system is really covering everything that is required for the patient to participate in the trial, including the travel expensing, the homeschool, the schooling opportunities, whatever is needed for the patient where the clinical trial takes place, and that there is an agreement between the countries that the follow-up costs are then fully covered by the home country. And I think that would make it the easiest. The discussion with the insurance companies about the liability insurance if something happens as a side effect or problem out of the trial, I think that can be solved because these are commercial organizations. So they have usually their subsidiaries in all the countries, but they are pan-European organizations. So if they change their rules, and there are not many, because there are not many insurance companies left who are offering liability insurance coverage for clinical trials, this is not a worthwhile business for them. So we would not have to negotiate with many of them. It would be perhaps one or two handful maximum. So that could be achieved, but it's really the long-term healthcare support costs in the home country that would have to be covered without discussion for those patients.
So a little bit different question. I've seen that you also work on health technology assessment and health technology. So do you see room for technologies that could help this process of cross-border access to clinical trials currently?
Very interesting. I had this discussion last week with head of HTA institute in one of the EU member states. I don't want to expose her here, and we had a long discussion about that. But I think that is even the next step to get into a recognition of this problem by the HTA bodies. I think that, and I'm also not sure whether it's really them who have to solve that. I think that is really an issue of the national healthcare systems that need to solve that, independent of whether this is now an approved drug or an investigational medicinal product. I think that is a principal problem of the healthcare systems. I mean, HTA is primarily evaluating the value of a new treatment in a country and the level of reimbursement that they are willing to pay. This is not a pricing question here. I think it's really something where, on one hand, we need to support the treatment options for patients, but also, and I didn't mention that yet, there is also the other side of the coin, and this is what you are doing in PCM for EU, that the patients are very well defined genetically, so to say, and then the investigators are looking for a suitable trial for their patients somewhere else in Europe. So I think if we would achieve that the healthcare systems accept that participation in a clinical trial is a healthcare option, is a treatment option, then we would already be a big step further.
So I think you have an ongoing work with the EU XCT program, and you have launched a survey. So maybe you want to tell us a little bit about this program and maybe motivate people that could see this video to go to the survey and fill it?
Yeah, at the moment, as I said, there is always a possibility. We have a website. This is not yet officially launched, but it's available on the web. So if you just Google EU minus X minus CT, you fall on that website that is currently available, and there you can also get access to the questionnaires that we have prepared for targeted approach. But everybody can look into them and can answer them, of course. But our big initiative for the survey for patients, that is only going to be launched hopefully soon, but we first need ethics approval for that. And currently we are still fighting with the last little details on GDPR and GDPR requirements and phrasing that. But we hope that the submission to the ethics committee can happen now in the next week, and that they will respond quickly, so that by the end of this year, beginning of next year, we will be able to launch also the big survey. And that, of course, for patients. And there, of course, we will disseminate that as broadly as ever possible, of course, also through LinkedIn. So if everyone wants to look there, it will also be on many different websites of EFGCP, of FPR, of UCROF, of many different organizations, of the websites of many different organizations. And in what we do there is that's an anonymous survey, but we at the very end we give the respondent the possibility to identify him or herself in a separate questionnaire, so to say, so that this will remain completely anonymous and we are not touching that. But if there is willingness to give us further information on experiences made, then there's a possibility to give us the email address, and then we contact them and figure out how we can explore further experiences and further information that we can collect from these patients.
I hope you the best for this program and survey, and this is a so important opportunity so that the voices of everyone working or using this situation or organization to go to a higher level at the EU, to have it organized in a facilitating way. I think for everybody, this is a good opportunity now. So.
Thank you very much. Yeah, we will try to make, or we try already to make as much noise as possible. I mean, we are currently over 50 organizations who are supporting that already. And every organization can, also individuals can become member of EUXCT. There is no obligation to it. It's just sending us an email and saying, hey, I would like, my organization would like to become a member. There is no obligation, no money, nothing. It's just to be available for supporting in whatever way what we are doing. And also afterwards, when we are coming up with the proposals for recommendations, solutions, etc., that there is a discussion, a joint discussion about them, and hopefully then also a joint signing up and support by all these organizations to generate the weight that we need to achieve changes.
So great. So on this good note, I thank you a lot, Ingrid, for having shared all this information and views, and hope to see you soon with further steps on this work.
Thank you very much also for the opportunity to share the information about this project with you and your readership or listeners of this video. Thank you very much.